schools, colleges, universities, and just in general medical centers. The reason I chose physical therapy to be my senior project was because my grandpa had many issues in which demanded that he have some physical therapy, and I wanted to be able to help people like him and be able to get the pleasure of the families that I was able to receive for him being in my life and being able to do the activities he was able to. But I didn't know really what to expect. I didn't know what physical therapy was. I knew that physical therapists helped patients, but I wasn't sure exactly as to how they did this. I was also curious what kind of environment was it going to be like. Was it going to be a happy, cheerful area because patients were there getting help and were, happy to be able to receive this help? Or were they a little bit more, or was it a bit more dreary, as if you see in a hospital? The only experience I kind of had in a physical therapy setting was from what you see in movies. As we all know, they're not necessarily always the most legitimate and honest when they keep to the movies. I also wanted to know what kind of schooling was going to have to require to become a physical therapist, and just basically what their day-to-day life was. And this I found through the job shadowing with my mentor, and I had a lot of experience actually, and I learned a lot of my questions. I put my experiences in at a clinical setting. The atmosphere I found was very light. The coworkers joked around with one another often, and they would joke around with their patients, which I thought was really interesting, that they had a really good connection with their patient. I found the patients that were there wanted to be there, so that answered another one of my questions was that, what kind of patients was I going to be dealing with? Age issues, just the personality. So for the most part, the patients there were very upbeat and everything. I asked my mentor once if they ever had anybody that was very begrudging, and he told me that if there was, then chances are they weren't going to be showing back up. So it kind of gave me confirmation that, for the most part, I'd be dealing with people that were in a decent mood, at least, considering they're in pain still. I also saw that physical therapists, they have to have extreme patience, because there was multiple times where I was watching my mentor and his patient go back and forth while he was trying to reword a question so the patient would understand, and so they could get an answer to help the physical therapist be able to understand what plan needed to be taken action that day. My visits go very similarly every time. The physical therapist greets his patient and leads them into a small private room, and they lay down on a table or sit on the table, just depending on their preference. And from there, a lot of different information will be relayed, such as where their pain is, what kind of pain they have, and on a scale of 1 to 10, how bad was it? From there, and also information that the patient had maybe received from the doctor in between the visits would be also relayed to the physical therapist. From there, stretches would be taken. A lot of the stretches, there was one particular stretch that I saw was where my mentor would have the patient scoot over to the middle, to the edge of the table and hang leg down the side of the table, and from there the physical therapist would slightly push the leg back, which would really stretch out this general area, and so that was a really popular stretch I noticed. After stretches were done, which is a lot of the hands-on, they would be led into exercises, and there was multiple kinds of exercises that were done. A really popular one were the lateral walks, and that would be where the patient would have a resistance band wrapped around their ankles, and from there they would walk down about a 15-foot line sideways, and that would help their hips, which in turn would help their back, knees, ankles, feet. So it was a really big one. It was a popular one for multiple people who had different issues. The bridges and neutral spines were also a very popular one. The bridges were the ones where they would be laying down on the table and they'd be lifting up pretty much their backside off the table. The neutral spine would be contracting the muscles within this general area together, and that would give a lot of support to the back. After this was done, the patients and the physical therapist would discuss any home exercises that needed to be changed, or if they were new, be given a list of home exercises to be done. They're kind of like homework, you have to be able to keep up on it between things to be able to get better. So, it's not, when you go to physical therapy, it's not just going to physical therapy, you have home stuff that you need to do, but they don't take long. The patients seem to tend to do very good on these, and if they weren't, I noticed that they were pretty honest with their physical therapist and no, I kind of slacked off this week. I would now like to be able to show you some of the tools and things that I've used. You can see that all right? My experience. This is part of the main room where a lot of the exercises we're doing. The table that you can see right over here was one that would be found very similar in the small private rooms. This is another part of the room, just a piece of different equipment, and it's used a lot for arm support I saw. This is called the stick, and this would break up the muscle fibers within the muscle, and it's kind of like a deep tissue massage. This is the plunger, and it's hard to see, but right here, it looks like basically a plunger, and a cool gel would be applied to the rim and pressed onto the back or wherever the muscle was, and that would create a lot of pressure, which would bring blood to that area. This is the electrostim. This is the main control part where you can up it or down the amount of electricity that's going through these things, which are being applied to the skin. It pretty much contracts your muscles, which can help a lot for a lot of different things. They are put to where the center of the pain would be right here, and they put around it, and they crisscross each other. This is me actually getting to use it, which is pretty cool, because I found that if you go up a little too high, it can actually kind of be a little painful in a way, so you want to adjust it to where you feel comfortable at. And now I have a news report on the physical therapy I found relative to my project.
When we have an injury, our primary concern is, will we fully recover? Physical therapy aids the healing process, rehabilitating patients back to full potential. Our Iron Mountain Keystone Bureau reporter Beth Cefalu visited a new physical therapy clinic in Iron Mountain and has more in tonight's Your Health Matters.
The United States Bureau of Labor Statistics defines physical therapists as an important part of rehabilitation and treatment of patients with chronic conditions or injuries. But is it effective? Some experts say yes.
Physical therapy is often a very important step in your rehabilitation process. It's a conservative step as opposed to surgery or injections or medications. It helps people improve their quality of life and return to their prior levels of activity.
Sarah says physical therapy is a great way to regain maximum capability. A 2012 UP Rehab Patient Satisfaction Survey shows 96% of their patients say therapy helped them recover, and 95% say, if needed, they will do physical therapy again.
Being able to control your own body and your own healing process is, through physical therapy, is more beneficial to people.
William Burgess came to Iron Mountain's UP Rehab Clinic with a shoulder injury and said the 14 treatments have worked wonders in his recovery.
I could raise my elbow over my shoulder, and now I can scratch my back and everything else. She's good. She's good.
He says prior to his treatment, he was skeptical, and now he's never been better.
Unless you go through something like this, you can't, a person can't believe it. Or the way he can manipulate you and put you back together like you were to start with, right? It's just unbelievable.
That's Cefalu TV6 News in Iron Mountain.
Next, I would like to go into a little bit of the schooling that is required to become a physical therapist. All physical therapists must be licensed to practice, which I'm sure we're all grateful for, considering they are in the medical field. They must complete a physical therapy graduate degree program approved by the Commissions of Accreditation in Physical Therapy Education, also known as CAPTA. Normally, you need a bachelor's degree and some volunteer experience to be able to achieve this, but a master's or doctorate is much advisable to get. A lot of your coursework will be in anatomy, physics, biology, and chemistry. On average, this schooling will take about 7 years, but it can take up to 8 years depending on your schedule. 6 years it can be done in, but it's very difficult to do it. The internet will tend to stay anywhere from 6 to 8 years, so it just kind of all depends though on your schedule and how you work that. When I first started the senior project, I didn't know if I wanted to be a physical therapist, and now I'm confident after my experience to know in my answer to that. And while I greatly enjoyed my experience, I don't think it is particularly the right career for me, and this mostly comes down to the amount of schooling for it. So perhaps maybe in later years, once I'm more, out of school and everything, maybe I perhaps will want to go back. But for right now, I do want to be able to continue on in the medical field, so I will be researching and looking into something that has a little bit less schooling requirements. But I was so grateful to have this experience and fulfill not only my senior project areas, but also give me some help in what I want to do when I grow up, which is coming up a lot faster than most seniors seem to expect. So thank you for taking the time out of your day to come and watch and let me share my experience with you. Thank you.